I'm Trish. I'm your student VN, and I'm going to teach you about, or talk to you about wound care and how to prevent wounds and how to prevent infection of wounds. First, we're going to go over the layers of the skin. The first layer is the epidermis, and it is the thin outer layer of the skin and composed of stratified squamous epithelium. I wasn't going to put that. Okay. The next layer is the dermis. It is under the epidermis. It's under the epidermis and is the largest portion of the skin. It also contains numerous collagen and elastin fibers that is surrounded by a gel-like substance. It lies on top of the subcutaneous layer, and the subcutaneous layer is not even considered part of the skin. It lies under the skin, and it helps insulate body from extreme temp and anchors the skin to underlying structures. Next, we're going to talk about how wounds occur. There is 4 ways of how wounds occur. The first is a surgical incision, and it's caused by a clean and controlled break of skin integrity. And the second is trauma, and it causes an irregular break in the skin or partial or full thickness loss of skin. Another is pressure. Pressure can cause skin tissue breakdown and disruption of skin integrity. And the last is burns. Burns can partially or completely destroy your skin. Now, there's factors that affect wound healing, and one of them is medications, some use of steroids, immunosuppressants, and other anti-inflammatory drugs like heparin. The other is lifestyle, which is regular exercise enhances blood circulation and thus promotes healing. It promotes healing. Smoking reduces the functional hemoglobin of the blood, and it limits your oxygen. The other is nutrition, and it adds protein and adequate fluid are of great importance, and it is rich in carbohydrates, lipids with vitamins A and C. That is very important. And age. Metabolism and regeneration in chronically ill and older adults are slower. The peripheral vascular disease impaired blood flow, which can impede healing. Some signs and symptoms of infection are increased pain, swelling, redness, or warmth around the affected area. Red streaks extended from the affected area, drainage or pus from the area, and fever. So be sure to keep an eye for some of those signs and symptoms. There's 3 different phases, and the inflammatory phase is localized. It begins immediately after the injury, lasts 3 to 4 days. Blood vessels constrict. The proliferation phase begins on the 4th day after injury, lasts about 2 to 3 weeks. The macrophages continue to clear the debris. The tissue is pink in appearance, and wound begins to close. The other is the maturation phase, remodeling. Begins about 3 weeks after injury. Scar maturation and remodeling occurs. Strongest scar tissue possible. Scar tissue slowly thins and becomes paler in color. Now, there are 10 ways to prevent wounds. Risk assessment. Using tools such as the Brighter scale help caretakers recognize a patient's risk of developing wounds. 2. Skin inspections. A patient's skin should be examined regularly for signs of pressure damage. The first sign of tissue damage is often non-blanching erythema. 3 is skincare. Keep a patient's skin clean. Can't say that enough. Make sure that it is dry and hydrated to prevent damage. 4 is moisture. Excessive perspiration, edema, and incontinence can cause damage from excess moisture. Incontinence and pressure often coexist. Nutrition. Good nutrition is essential for for wound prevention and healing. Keep patients hydrated is also a vital part of preventing wounds. The seventh is position. The position of a patient's body should be considered when trying to prevent further wounds. Ergonomics refers to making such a patient's environment is suited to aiding and performing everyday tasks. Number 9 is repositioning. All patients should be encouraged to reposition themselves regularly. For patients who require assistance, repositioning should be done with consideration for the patient's comfort, dignity, and functional ability.